Okay, so sterile products, we've already talked about a lot of this anyways. Aseptic technique. We know that things need to be stored, and how are things supposed to be stored?
With, gosh,
However it says on the label. So some things are refrigerated, some things are not supposed to be refrigerated. Some things, if you refrigerate them, it makes them crystallize. Same thing if you mix it with the wrong thing. It can crystallize even in like your veins. So that would not be a good thing. So you have to watch really carefully about what you can mix things with and what you can't, and how to store things. Of course, labels and records and all that kind of stuff. PPE for sterile products, want to remain sterile. There's a hood. We talked about that. Okay, inventory control. So since the director of pharmacy is responsible for medication inventory, but a lot of times that will definitely be a pharmacy tech type of task, okay, to look at inventory, figure out what you need, and so forth. So it's really important that you just get kind of a routine going. If you take out the last bottle of your stock medication, you know what's right, like how much is in there, and add it to your list, or however the pharmacy does that, their whole process.
Yeah, we have stickers.
You have stickers.
Like every bottle has a sticker on it or whatever with the number it came from. And then whenever the bottle like partially empty, we'll stick it on the main computer and they'll order it.
Okay, you just take the sticker off of it and put it on them.
Yeah.
Okay. So every pharmacy will be different, but just make sure that you're diligent to do that, because you don't want to get to a place where you don't have a medicine and somebody needs it. Sometimes you still have to order stuff because you don't have it in stock or whatever, but anyways, just make sure that's something that will definitely be a basic pharmacy technician task, So inventory should be quickly accessible, as inexpensive as possible, of course, high quality. So the Pharmacy and Therapeutics Committee determines which meds will be purchased in stock. You've probably seen before the P&T Committee, but if not, you'll see that, I promise you'll see that on your test, the P&T Committee, and that's what it's talking about. Pharmacy and Therapeutics Committee determines what meds will be purchased and stocked at that particular pharmacy. Okay, so P&T Committee, remember that. Checking inventory, purchasing systems. Okay, there's a couple different ways you can do this. Independent says these are manufacturers where you contact them directly. And then group purchasing organizations, you have lots of hospitals that negotiate with the manufacturer. So maybe if you have several hospitals in your system, you all negotiate a specific price with a certain manufacturer and get all your meds from that person. So methods of purchasing, and you'll see some of this on your test too. But direct, of course, like I said, you just directly from the manufacturer. You can get it from a wholesaler, so like a supply company that does lots of medications. And then purchasing from vendors between the hospital and a single wholesaler kind of helps to specify specific. And you'll see that, especially in the hospital sometimes, they may not have, like if you take, I don't know, whatever medicine at home, that hospital may not carry that medicine because they use a specific manufacturer, but they might carry one that works the same or is really similar, if that makes sense. Automation, of course, we know the more automatic the process is, in theory, the less errors you're going to get. Okay, so computerized entry systems, and this is how a lot of them work today. A physician, instead of writing his order in their chart, they'll go put it in. It's just, there's a place for them to write it online, because almost all charting at this point is electronic anyway. And when it does that, it'll automatically send to the pharmacy to have it filled. Should reduce errors, because again, you don't have that middle person. Robotic dispensing, it says robotic devices interface with the pharmacy information system and will fill each patient's medication tray in their 24-hour cart. So it can return credited medications and lots of different things. That would, it's probably not something that we might not have something like that around here. But roles and duties of pharmacy technicians in the hospital. So definitely maintenance of any kind of record keeping. That's definitely a pharmacy tech type of duty. Confidentiality, we know about confidentiality. Setting up unit doses and outpatient prescriptions. So especially getting if somebody is being discharged or something like that, getting them ready to go. Compounding, And it says administering medications, but I can't think of any time you would ever actually do the administration of a medicine. Now, a pharmacist does, like in our trauma rooms, I think at Children's, and maybe wasn't, I can't remember, but the pharmacist can always give a medicine. So that's something that's within their scope of practice to actually administer the medication as well. Of course, compounding we've talked about, roles of the pharmacist in the hospital, maintaining the accuracy of the dispensed product, so making sure that it is what it's supposed to be, controlling meds, ensuring proper compounding techniques. They have a supervisory role, especially over their pharmacy tech. So if you as a pharmacy tech do something wrong, they're responsible for it too. Reviewing orders, supervising the med administration, monitoring medication use, general duties, documenting training for sure, education, policies, procedures, putting those into place, and then evaluating. Pharmacy tech, packaging and preparing labels. Okay, we've done that quite a bit at this point. Like we've gone from created labels from prescriptions at least, when you can read them. Delivering prescriptions to the outpatients, inputting computer data, that's funny. So, refilling drug carts, prescriptions, maintaining the inventory. Like I said, that's definitely a pharmacy tech type of task. Communicating safety procedures, labels. Policy and procedures, this is something that you'll refer to if you're not sure how to do something. Everything should be listed in a policy and procedure manual. That should be readily accessible at all times. So it says a policy is a statement of definite method of action, so the way to do something, and then a procedure is, or it says policy provides a framework for an action, whereas a procedure gives you the steps it takes to do that, whatever it is that you do. So this needs to, if you're trying to figure out how to do something, that's where you need to go. Policies, there are other policies and procedures that would be added in, like the FDA. They have a specific way to do something for a particular drug, especially like a new drug, there's going to be specifics. State Board of Pharmacy, we've talked about JCO before. I think it's called something else now, but Joint Commission, I think it's just Joint Commission now, maybe. Lots of strict rules. I don't even know a policy and procedure manual is, and you're not going to be writing it. Regulating agencies for hospitals, so Joint Commission lays out specific guidelines, and they are usually pretty specific, and they expect you to follow them. Board of Pharmacy registers pharmacists and pharmacy technicians, so you're registered with the state. Says CMS inspects and approves hospitals to provide care for Medicaid patients. So specifically for Medicaid. And then says the DPH oversees hospitals to ensure compliance with laws concerning their practice. So, and then the future hospital pharmacy, more automation, hopefully. I think, well, everything's automated quite a bit at this point. Okay, let's go ahead and do chapter 19. It's really super short.
Do you make these, or are they already made?
They're made. Okay, so community pharmacy. It says there's more than 60, and this is an old number. I'm sure there's more now. 60,000 community pharmacies in the United States. You can have independent or chain. Okay, so Miller's would be like an independent because CVS would be a chain. Says a prescription is an order for the medication. We know what that is. Pharmacy tech's duty is to be precise in filling that. If you can't read something, always if you can't read it the first time, ask the pharmacist. They may already know the doctor's handwriting. You kind of get used to it because you think about it, especially in Cooper, you've got pretty much the same doctors you're going to see most of the time. Not always, but most of the time you're going to see the same physicians come through. And over time, you get to where you can read their handwriting a lot better. So always ask the pharmacist. If you still can't get it and you're really not sure, always just call and ask. It's not going to hurt anything to call and ask. I mean, I've called doctor's offices before, and the nurse did not know what it said either. She was like, I'm going to have to ask the doctor and get back to you. She reads her handwriting all the time.
That's
So
so bad. Why are they always?
I'm just in a hurry, you know.
Yeah.
So the prescription has to include the address of the prescriber's office. So usually, that's printed like in block at the top. The name and address of the patient. Actually, most of these days are just printed. They just print it out and hand it to you. The date, the inscription, the superscription. So the SIG, refill if there's anything that's supposed to be on it that's special, and then if it's for a controlled substance, of course, they have number T. Processing prescription, so receiving, working at the drop-off counter, reading and checking the prescription and checking it again. Don't ever want to just read it once and do what you take it from there. Numbering, and what is your procedure at? Well, I guess you don't do a whole lot of it. Well, yeah, you do now that you've got your thing. You probably get to do more.
Oh, a lot of it
Filling.
they just send it. They have like this computer system that reads it and then they'll type everything in and send it off. They have like 3 different computers, and every computer has one little thing that it does. And then at the end, it's checks.
Okay. He checks everyone that goes through. Good. Cool. So how many times are you supposed to check it, or does the computer do most of that?
The computer does a lot of it. We'll put it in there, and then we'll make sure before we send it to Yogi, we'll make sure it's the same stuff and the numbers are right.
Okay.
And for like C2s, all of the controls will count twice.
Okay. Cool. So numbering and dating, labeling, of course, and then prepping the actual prescription and then doing the packaging. Does it automatically create a label when you put that in, or do you have to hand type the like you have to write it out? So processing prescriptions, of course, rechecking, like I said, patient counseling, which is not a pharmacy technician task ever on any question. If it says anything about counseling, that is a pharmacist task. Pharmacy? Yes. So if it asks you, like and some of these questions you'll see, if it asks, patients wanting to know if they can take their, they can take this over-the-counter medicine for blah, blah, blah. Refer them to the pharmacist. Okay. So, most of the questions on these tests, if that's an option, it's usually the answer. Not always, so make sure you read it, but a lot of times that's the answer. Refer, ask the pharmacist or refer them to the pharmacist. Organization, so prescription counter in the consulting area. The transaction window depends on where you are. Miller's is pretty much just one place, but like at Walmart, there's a drop-off place. Somebody works there. Somebody works at the next section. They have a little counseling booth too. There's always going to be special, if something's controlled, there's going to be some kind of special probably procedure that you go through to check that. And then professional characteristics of pharmacy technicians, accountability. So just being responsible for what your task is and taking care of business. Ethical standards. Okay, if you do something wrong, just don't let it just be like, oh, I don't want to tell anybody because you're afraid you'll get in trouble. And you get in a lot more trouble if if something happens and you didn't say anything. It's always better to just come clean. Now I'm not saying just talk to, say what you did, figure out what went wrong, fix the problem, talk to them through all that. I'm not saying you don't want to just you cause this big issue and you just dump it in somebody else's lap to fix. Talk through it. So, hey, they went home. I put this medicine back and I'm not sure. I feel like maybe I grabbed the wrong medicine, or I think I gave them a 3-day prescription instead of a 10-day prescription, or whatever it was. You start thinking about it later on and you question yourself. Just say what happened, take care of it. Call them. Hey, can you count how many pills you got, or what is your pill? Have them describe the pill. Maybe they were supposed to get pink pills and, whatever. So take care of it and be willing to take care of it and fix the problem so that you're not doing that same thing in the future. Maybe you need to come up with your own set of checks and balances kind of thing. Does that make sense? Communication skills, of course, always, that's going to be really important in any workplace. We've talked extensively about communication, maybe excessively, I don't know. Teamwork, always make sure that you're able and willing to work with others. You're always going to have somebody that's going to be the hard person to work with. If there's nobody that's hard to work with, you might be the person. So, but there's always, it's just communication is the key, really the key to that, to teamwork too. So it's just important that everybody knows their job, everybody does their job. And at the end of the day, whether somebody does their job or not, if you're working with a team of other pharmacy technicians and there's something that the pharmacy technician task, and at the end of the day, the person who's supposed to do it didn't, it's still going to fall on everybody that's responsible. So it still has to get done. And so, sometimes you get slacker people that don't do their job, and that's just life. Just don't be the slacker yourself. So anyway, ability to handle fast pace and stress. Does it get stressful up there? Mondays
Mondays and Fridays. And then especially when the ice storm hit, it was like pretty crazy. Because everybody came, like one day it was about to rain or whatever, and everybody in Cooper, Texas came. And I'm like, God.
Yeah. I'm sure I had that stressful moments. Okay, that's it.
You're at Cooper, Texas.